EVOS presents स्वास्थ्य संवाद एवं कनक न्यूज द हेल्थ कॉन्क्लेव 2023 को पावर्ड बाय यूजेनिक्स हेयर साइंसेस एवं कमल वाच को सिंस 1969 प्रेजेंटिंग स्पॉन्सर EVOS को पावर्ड बाय यूजेनिक्स हेयर साइंसेस kamalwatch.co since 1969 supported by Apollo Hospitals Touching Lives, Kalinga Super Speciality Hospital, Amri Hospitals, a joint initiative by Swasthya Sambad एवं Kanak News.
I'd like to introduce the next session, which is the flagship session for the evening, and that is Dr. Randeep Guleria in conversation with Sri Subroto Bagchi. I'll request the AVs to please be pleased.
पद्मश्री डाक्टर रणदीप गुलेरिया देशर जड़े सुनामधन्य पल्मोलोजिस्ट दिल्ली एम्स पूर्वतन निर्देशक कोरोना समय जहां मुहरु पदे कथा शुणवाक अपेक्षा करी रहुथिले देशवासी कोरोना नियम पालन पाई परामर्श हेउ कि चिकित्सा व्यवस्था संपर्क में डाक्टर गुलेरिया जानिबा परे लोके आश्वस्त हेउथिले देशर कोविड मुकाबिला रे रहिछि तांकर गुरुत्वपूर्ण भूमिका कोरोना महामारी मुकाबिला संपर्क में लिखित पुस्तक टिल वी विन रसे हेउछंती को ऑथर जनरल मेडिसिन रे एमडी और पल्मोनारी मेडिसिन रे डीएम करिबा परे एम्स रे जोग देइथिले डाक्टर रणदीप गुलेरिया पल्मोलोजी विभाग मुख्य हेबा सह दिल्ली एम्स रो निर्देशक दायित्व तुलाइथिले पूर्वतन प्रधानमंत्री अटल बिहारी वाजपेयी व्यक्तिगत डाक्टर भावरे से कार्य करथिले फुसफुस संबंधी रोग संपर्क में से अनेक संदर्भ लिखिछंती जहां देश विदेश रे उच्च प्रशंसित होईछि चिकित्सा विज्ञान रे तांकर उल्लेखनीय अवदान जोगु 2015 मसीह रे तांकु पद्मश्री सम्मान रे सम्मानित करा जायथिला 2014 रे तांकु मिलिथिला मर्यादाजनक डॉक्टर बीसी रॉय जातीय पुरस्कार पद्मश्री डाक्टर रणदीप गुलेरिया को स्वास्थ्य संवाद और कनक न्यूज रो हेल्थ कॉन्क्लेव को शुभेच्छा और अभिनंदन। सुब्रत बागची केवल ओडिशा रे नुहे देश विदेश रे मध्य एक परिचित ना माइंड ट्री रो सह प्रतिष्ठाता ओडिशा स्किल डेवलपमेंट अथॉरिटी रो अध्यक्ष जणे जनाशुना उद्योगी भावरे से जेतिकी जनाशुना जणे समाजसेवी भावरे तांकर रहिछि सेतिकी ख्याति जनहितकर कार्य पाई तांकर आग्रह सबुबेले देखिबाकू मिलिथाय भुवनेश्वर कैंसर हॉस्पिटल और पैलिएटिव केयर पाई सुब्रत बागची और तांका पत्नी सुस्मिता बागची 340 कोटी टंका दान करी अन्य मानक पई उदाहरण सृष्टि करिसंती कोरोना महामारी को नहीं जेतेबेले सारा राज्य रे आतंक खेली जाइथिला सेतेबेले कोरोना स्थिति नहीं सरकार को पक्षरु टेक्निक तथ्य गणमाध्यम रे रखुथिले सुब्रत बागची कोरोना मुखपात्र भावरे सरकार सचेतन वार्ता विश्व महामारी संपर्क रे तांकर वर्णना ओडिशावासी मन को छुई पारिथिला कोरोना मुकाबिला पाई मुख्यमंत्री रिलीफ फंड को 10 कोटी टंका दान करी चर्चा रे रहिथिले सुब्रत बागची श्रीजुक्त सुब्रत बागची को स्वास्थ्य संवाद और कनक न्यूज रो हेल्थ कॉन्क्लेव को शुभेच्छा और अभिनंदन।
Ladies and gentlemen, we are extremely honored to have with us today Padma Shri Dr. Randeep Guleria, a revered Indian pulmonologist and the ex-director of All India Institute of Medical Sciences, New Delhi. In conversation with Sri Subroto Bagchi, co-founder Mindtree and chairman Odisha Skill Development Authority, was appointed as the spokesperson of the Odisha government during the pandemic. I request all of you to kindly put your hands together once again as we welcome both the stalwarts on the stage. Thank you.
So good evening, Dr. Guleria, and you are a pulmonologist. So on behalf of Odisha, Odisha government, the Sambad group, and everybody here, welcome once again. And I would like to ask you, how's the air quality in Bhubaneswar?
It's really a pleasure to be here in this health conclave. You're right, it's nice to be out from Delhi because Delhi, not only is it cold.
In one way or many ways?
In many ways, because the weather there it's a little bit chilly there, and the air quality is not as good as it is in Bhubaneswar.
So, doctor, here it is. We'll switch to COVID for a moment because, as the audiovisual was again saying, that you were the face of assurance for the country during the difficult days. Let me ask you this: were there moments when you felt afraid?
Definitely, I think we were dealing with the unknown, And especially in the early days, not only doctors, all health professionals, the general public, all of us were scared because we didn't know how the virus would interact with the host, that is humans. The severity of illness, the transmission, would we carry the infection to our homes and give it to, let's say, our children or our parents or grandparents? All that fear was there. And I remember the first few days when we were setting up the COVID ward, many people said that, you're wasting your time, nothing is going to happen. And then we had the first few cases, and there were a staff nurse who refused to go home because she had just crossed a suspect COVID patient. She had not even touched the patient, but she felt that now her whole body had been infected with the virus, and she would go home and give it to her parents. So that was the type of fear that we had. I had to deal with another fear at home because my wife is also a doctor. She was also working in a different COVID hospital. My son was working in another COVID hospital. My daughter-in-law, she's also a doctor. So all four of us were sleeping in different rooms and having dinner separately because we were worried that if one of us got the infection, we would give it to the others. So it was a tough time both from the family point of view, and there was definitely an element of uncertainty.
But you clearly had this determination that we'll win the war, and that is the theme of the book that you wrote. Very interestingly, in the book, you have given huge amount of credit to the frontline warriors. Now that brings me to two questions. One is I would like you to elaborate on that as to what significant contribution the frontline warriors actually made. But more importantly, and here it is a little bit of controversial issue, in this country, doctors tend to be overrated at the expense of all the other people that make up the medical system. So I'd like you to reflect first on the contribution of the frontline warriors, and second, please help us to decode this social obsession of equating the healthcare system with doctors and great doctors.
So I think everyone played a huge role as far as COVID was concerned. I think all of us, the entire population, to some extent played a role, and I would say everyone was a COVID warrior. But the frontline workers, whether it be healthcare workers, ASHA workers, people who were working at the ground level, I'm not talking of the hospital, but doing the testing, doing the screening, the police officers working in the containment zone and containment areas, all of them were equally exposed. And they had less knowledge about the virus. They were not really taking all those precautions in terms of PPEs and other things. And that is why I think they were and did play a huge role as far as managing the pandemic was concerned. Regarding your second question, yes, I personally feel that it's not only that other healthcare workers are not given the importance, it's a big loss for us because I feel that if we are able to get them into the folds, the health system can do much better if we have practicing nurses, nurse practitioners for that matter, who could prescribe medicines in areas where you don't have doctors. We have teleconsultation now. They could consult a physician and then be used as nurse practitioners. We could use the other allied services in various areas. The healthcare system could be used in a more efficient manner than relying only on doctors and using others for work which is now not that important. It may have been important, but technology has come in a big way. And that has really changed the whole perspective as far as healthcare is concerned.
So doctor, actually you alluded to medicine being science and art, and we'll talk about science for a while. There's a lot of conversation about ChatGPT, and certainly with ChatGPT clearing medical tests and engineering tests and so on, the whole conversation about artificial intelligence has become center stage. What is your take on the role of artificial intelligence and what it will do to the world of medicine?
So I think artificial intelligence will change medicine to a large extent. We are living through what is known as the fourth industrial revolution, seeing changes in healthcare occurring like we've never imagined before. I mean, the changes that I saw we've seen during our lifetime, we thought those were great. I mean, when I was in medical school, I would have to go to the post office and book a trunk call to talk to my parents and wait there for 2-3 hours and then, have this very bad connection. And then we had STD which came up, and we were very happy that now you can make a straight trunk dial and you can directly talk. Today's generation couldn't imagine that you had such a situation in your lifetime.
Yeah, we could never imagine doing video conference, at the, it's forget about video conference, to have a video calling was unimaginable when we were growing up.
So the change has actually become even faster now. AI, 3D printing, big data analysis, wearable devices. People can monitor their ECG using their wearable devices and know whether they're having an arrhythmia or not. All of this will become part of healthcare. AI will help doctors, I think, in 3 or 4 areas, radiology for that matter. There's already a program which the government is trying to see, can we use an AI-based technology where doctors or even others at a rural area can take a picture of an X-ray, it could be a chest X-ray, it could be an X-ray of a bone, and AI could help them diagnose what the disease is or whether it's a fracture or not. A picture of a skin lesion. AI could help you tell what is the skin problem that you have and what could be the likely treatment that is available. So it could complement what doctors are doing. It's for pathology also. A slide could be looked at better if it was associated with AI support in terms of picking up abnormal cells. So I think it will change the way medicine is practiced as far as technology is concerned. One of the things that we saw was
But do we risk losing empathy in the process?
Yes, so that is what I'm trying to hint at, that medicine still is a science and art. And would you say that since science has progressed, art is not important today? I think it's even more important today, because although science has progressed a lot and we are having AI and all of this coming in, the person will go to a doctor who empathizes with him, who understands his problem, and who really wants the patient to be all right. And that's why even if you have your computer-based diagnosis, an individual will be happy only to talk to another individual who empathizes with you.
A human being to a human being.
Correct.
There are a lot of people, a lot of doctors actually in the medical profession who think they're God and they play God. On the other hand, great doctors like you actually see God in the patient. So I want to ask you, you're a great doctor, you're nationally respected, internationally respected. Tell us some of your patient moments that actually changed you as a human being. So in your entire life, there have been probably millions of patients who you have touched. So what are those 1 or 2 patient moments where the patient actually changed you?
I'll give you 2 or 3 stories where I'll try and highlight even what I said, the importance of the art and the science of medicine, but also the fact that you will have patients who come. I used to sit in the OPD from early in the morning and till late in the evening. I mean, I used to sit at around 8:39 and sometimes get up only at 7 in the evening. And it used to be very crowded, and I used to feel so sad that there are patients who would come and tell me, I came at the time that you entered the OPD, and now at 4 o'clock my turn is coming. So I've been sitting outside also. And I would say that, why didn't you go and eat something? He said, no, I thought maybe someone would call my name and I would go in. So that type of the dedication, or I would say the involvement that patients had, makes you feel even more humble that, if you have a patient who's willing to wait so much to see you just for a few minutes, then you really have to give your best to be able to provide care to them.
But no, tell me a story of that one patient that brought tears to your eyes.
And then these patients, for example, some of them come from a very poor background, and they would, bring you some gift which you would feel so touched with. One patient bought me a pair of socks. Yeah. Or someone said, I bought this jaggery from my village because I thought you may like it. So those are the type of things. I mean, I knew that they would have thought about it, and it's not that they could afford a lot of such stuff. So it's that type of things that make you really feel that this is the reason why you are in this profession. I'll give you a story. And this is a lady whom I saw. She had a lump in her breast, and it was operated and removed by my brother, who diagnosed as breast cancer, but she was all right. She had a follow-up PET scan done about 6 to 8 weeks later. And at the radiology department where she had it done, the radiologist told her that the scan is showing uptake in different parts of your body, and you are now have stage 4 cancer. You just have a few weeks to live, and I think you should now start seeing how you can settle things in your life. She went into severe depression. She went and met my brother, and he asked me, can you have a look at her? Because I was pretty sure that I had removed it, but it's possible that the tumor may have come back. So when she came to me, I looked at the PET scan. The PET scan showed lesions in the lung, in the upper part of the lung. It showed lesions in the glands. It showed lesions in what is known as the ileocecal junction, where the small intestine meets the large intestines. Now, if you look at it, all of these are areas where you see tuberculosis. You don't see breast cancer. And so I told her, I don't think you have metastasis breast cancer. I think you have reactivation of tuberculosis. And I would actually advise you to start TB medicines, and you should be all right.
Unbelievable.
And she told me that for 1 month she had not slept.
Yes.
She went
I can
into
imagine
severe
that.
depression. She was arranging the marriage of her daughter.
It's like somebody has given you the death warrant.
And then subsequently she went to Bombay, and then an FNAC was done. It showed TB. She comes every year to meet me on Diwali, and she tells...
What a nice story. What a nice story. Beautiful, beautiful. So that takes to the final question that we have with the limited time, and I wish we had more time. So we go back to Randeep Guleria, who's not yet a doctor. St. Columbus, you're coming out, boy from Himachal Pradesh, idealism in the eye, little confused between, whether we'll go to NDA or go to medical school. And suddenly on your hand, you have an offer from Stanford, one from Harvard, one from Yale Medical School, and one from All India Institute of Medical Science. Where will you go and why?
So now it's going to be a little bit of, because of what I know, I would definitely go to the All India Institute of Medical Sciences, New Delhi. The reason for that I can give to you also. The type of training that doctors get in India is far superior to the type of trainings you get anywhere in the world. The patients that you see here and the type of passion that you have in your teachers in terms of making you learn is unmatched. And now that I've been at AIIMS, I've had people come from Harvard on elective postings. And I still remember many years ago, this is about 2 decades ago, a young girl who came and she spent 2 weeks in the emergency and 2 in the medicine ward. And she said, I'll never see such patients in my life. And how do you manage to see such a large number of patients in your emergency and in the OPD? It was an eye-opener for her. She used to go back in the night and examine some patients because she said, I've never seen such a large spleen. And she'd keep palpating it because she felt that you'd never be able to see it again in her life. So those are the type of cases and the experience that you get, which actually makes you a better doctor for the future.
So thank you very much, Dr. Randeep Guleria. I think he deserves a big hand. And once again, welcome to our beautiful state. And
thank you.
We hope to host you again in the near future sometime. So thank you, doctor.
Thank you. It's my pleasure. Thank you.
Thank you so much, Dr. Randeep Guleria and Shri Bagchi. I'll now request and invite Shri Soumyaranjan Patnaik, Chairman, Sambad Group, to kindly join us on the stage and felicitate both stalwarts we have with us on the stage. Well, once again, I'd like to welcome you all, ladies and gentlemen, to the Health Conclave 2023. And I'd like to kindly request Ms. Tanaya Patnaik, Executive Director, Sambad Group, to join us on the stage and introduce Swasthya Sambad to all of us.
Hello again, and thank you everyone. I'll just briefly tell you what Swasthya Sambad is. Swasthya Sambad is basically a platform, a digital content platform from the House of Sambad, जोठी आमे आमरा श्रोता मानुंकु, आमरा दर्शक मानुंकु, आम पाठक मानुंकु डॉक्टर्स मान का सांगेरे हेल्थ केयर इंस्टीट्यूशंस मान का सांगेरे रोग सांगेरे रोग विषय सूचना सांगेरे आउ तार चिकित्सा सांगेरे जोड़िबा पई प्रयास करि थाउ। आमे संवाद ग्रुप रो विभिन्न वर्टिकल्स रेडियो चॉकलेट हो संवाद हो कनक न्यूज हो बा डिजिटल वर्टिकल्स हो ता सांगेरे कोलैबोरेट करिकी we try and give a one of a kind multimedia experience to our viewers, listeners and readers to know more about health and to take conscious decisions about their health. We're soon going to be building a one of a kind directory where patients or where interested people can look for doctors and hospitals and healthcare providers in their respective areas. We have Dr. Randeep Guleria here with us. We had a very, very wonderful conversation with Shri Bagchi, and I would like to take this opportunity to request Dr. Randeep Guleria to launch our website, swasthyaSambad.com. We are a fledgling organization. We are very, very new, so we need all your blessings, Dr. Guleria's blessings, so that we try and create some kind of impact and meaning. I would also like to request Shri Soumyaranjan Patnaik to join us on stage.
इवोस प्रेजेंट्स स्वास्थ्य संवाद एवं कनक न्यूज द हेल्थ कॉन्क्लेव 2023 को पावर्ड बाय यूजेनिक्स हेयर साइंसेस एवं कमल वाच को सिंस 1969 प्रेजेंटिंग स्पॉन्सर इवोस को पावर्ड बाय यूजेनिक्स हेयर साइंसेस kamalwatch.co since 1969 supported by Apollo Hospitals Touching Lives, Kalinga Super Speciality Hospital, Amri Hospitals, a joint initiative by Swasthya Sambad एवं Kanak News.